Before examination, I'll empty the bladder because it can be false positive for or false results for a symptoms of underwrite non-engagement, that whole thing. And then position is in the dorsal position with legs are flexed. First period of gestation we should know before doing the examination, because symptoms of underwrite is done between starting from 18 weeks till the 36 weeks. Symptoms of underwrite. And one of the importance of symptoms of underwrite is Johnson formula, that is to calculate fetal weight at the term. Then one for Leopold's maneuver, it is done between after 28 weeks. So the period of gestation before, if we are examination doing before 28 weeks, you can just comment on all the fetal structures were palpable. Like no grips should be done, and after 28 weeks the grip should be done. And one more is abdominal grip, that is done after 30 weeks of gestation. Then starting from symptoms of underwrite, we start from the CP sternum and gradually moves downwards and palpate the fundus of the uterus. Once we find the fundus of the uterus, if there is any levo rotation or dextro rotation, we just support it from other end. Then we palpate the symptoms of underwrite. Then we calculate the length, that is in centimeter. We should usually measure from inches tape to rule out a bias. Once we calculate it, then if it's correspond to the period of gestation, then it's normal. Then coming to the grips. Obstetric grips.
There are 4 grips. First fundal grip, lateral grip, and then first pelvic and second pelvic grip. These are totally called Leopold's Maneuver grips.
Then coming to first grip, that is fundal grip. We have to stand facing towards the patient side, along the pregnant lady side, then along the ulnar border, and palpate the fundus of the uterus and feel for the structures. That is, if you feel usually the on common presentation is breech. Breech is felt like smooth, broad and irregular and non-palatable structure. This is commonly suggestive of breech presentation. And coming to the lateral grips, same, standing facing towards the patient side and supporting the one side of the uterus and palpating the other side. If one side, if you feel smooth, resilient and curvilinear structure, suggestive of back or spine of the baby, and the other side same, if you support from this side and palpate from this side. If you feel knob-like structures, then it's suggestive of limbs of the baby. If both the side, if you feel the same resilient or curvilinear structure, it's suggestive of multiple gestation, then you have to retrospectively go and palpate the individual hypochondrium or to look out for individual presentation at the fundal grip of each baby. When coming to pelvic grip, pelvic grip, extend the pelvic grip, extend the hand so that you can grip easily the presenting part. One is, if you feel structures like hard, globular and independently palatable, it is suggestive of head. And if it is palatable, then it is suggestive of it is non-engaged. Usually the palatment is due to atlanto-occipital joint. That is the movement at the atlanto-occipital joint. The head is easily movable. If it is not movable, it is suggestive of head is engaged. To confirm the engagement is present or no, we can do the 4th pelvic grip. That is, we have to face towards leg of the patient and try to oppose the fingers. If there is a convergence is present, then the head is not engaged. The fingers are diverging, that presence of engagement of the head. Can you understand the obstetric grips?
Yes, sir. I understood. Fundal grips, lateral grips, first pelvic and second pelvic grips.